So thank you for showing up for this midwifery hour. It's a bit of an unusual one. We don't normally talk about love and midwifery in the same sentence. It's quite unusual. Other disciplines have looked at the role of love. For instance, nursing, there's considerable work, including research studies and concept analysis, which have looked at the role of love, and also some branches of medicine, particularly palliative care. So we're for some reason lagging behind a bit here, and perhaps we'll touch on why that might be. I want to give you a little bit of background as, you know, why on earth are we talking about love? As the song goes, what's love got to do with it? So if I kind of tell you a little bit of background. So my research focused on compassion, as Jenny said. My PhD involved interviewing women that had recognised themselves that they'd had compassionate midwifery, either from a particular midwife or it may have been several midwives, but they could put hand on heart and say they had compassionate midwifery, and they told me what that was like. Perhaps a little important thing I need to tell you is one of the first things they said when they were interviewed was they explained about the context of that compassion. They explained why they needed compassion at that time, and they really told me about what their suffering was at that time, which meant that they really had a need for compassion. Now that's quite important because a simple definition, sort of well-known definition of compassion, is an awareness of suffering in oneself or in other people, and the motivation to want to ease that suffering. And we might also say it's not just motivation, we need the motivation, but we might also say in midwifery that we've got to have the skills and ability to. So I'm not going to say too much more about that, but I wanted to give you some background because there was a lot more to it than that. But following the PhD, when you've looked at something so deeply and studied it so deeply, the thing is, quite often, it doesn't answer all your questions. It may answer some. It did give us a much clearer picture of what is involved in compassionate midwifery, but it actually posed some new questions. And a new question that I had was, what is the motivation? So if we think again about that definition of compassion, means that we actually notice others' suffering, we're aware of it, and that we have the motivation to try to help. Well, why would we bother? I have got a bit of a tendency to ask, you know, if one question's answered, then I've got a deeper question. And probably that's what I was doing there. But what is that motivation? So my own journey on this and talking to various people about what that might be and what that's all about is that I am wanting to consider whether this is all to do with love. Now, whoa, hang on a minute. Love is a big word and it's a broad concept. But we know that love does have a lot to do with childbirth. We know that really as midwives and birth workers. We know that that's the physiology of labour, birth and breastfeeding are all under the influence of hormones. And in particular, we think of oxytocin, and we even sometimes call that, for shorthand, love hormone. We see for ourselves the impact of a loving partner in labour. We see for ourselves that women falling in love with their newborn babies. And we look at how that gentle voice, that skin-to-skin contact, how that close, loving contact actually nurtures attachment and breastfeeding. So there's nothing new there really to say, because we do know that love plays some sort of part, and maybe really at the seeding of human love. But of course, there are many types of love, and tonight I'd also like us to consider another kind of love that we could use in our work, the sort of love which is about caring human connection, and it's sometimes referred to as loving kindness. And in Buddhism, they refer to it as metta. But loving kindness is broader than Buddhism. Buddhism perhaps has got quite a lot to say about it, which is really interesting. But it is quite a broad concept now. And so loving kindness, some of you perhaps who are listening tonight may have done some mindfulness or meditation, and you might even be familiar with loving kindness meditations. And what's interesting about that is it's been shown by many, many studies now that doing a daily loving kindness meditation or mindfulness session has a lot of benefits for well-being, for mental health and physical health, and for our own relationships, benefits for that. So it's quite powerful stuff. So in that context, if I go back to the question, what motivates us to provide that caring, that compassionate care, I propose that it is this type of love. But I'm really open to it. We're only at the start of introducing this idea. So it's just about considering what that might be like for other people, whether they see it in a completely different way, and we'd like to hear that. Brené Brown, and some of you might be aware of Brené Brown and have seen her TED Talks and things. She talks about wholeheartedness in the workplace. And reading her work made me think about, well, what would that be like in maternity care? What would it be like to bring your whole heart into maternity care? What does wholehearted maternity care look like? And I was thinking about this afternoon, and I thought, well, we know really, don't we? Any of us that have been around maternity care for a while, we absolutely know it when we see it. So midwives, doulas, I mean, perhaps more importantly, women who've received maternity care and families who've received maternity care know what it's like to bring your heart to midwifery, for it to be authentic. And we also know what it's like when the heart isn't there, the heart's not in it. So I think we do, although we haven't talked about this very much at all, and when I say we, I mean in the profession, I think we do have an inkling about this already. So it's time to talk about love and midwifery and think about what it might be. And that's where we are. That's what we're doing here. Over to Jenny.
So yes, ideally tonight what we'd like is to have a bit of a discussion, but we're trying to give you a little bit of our background. And what's interesting is that I did my research, as Sue pointed out, I was looking at trauma and interactions between women and midwives that were not optimal and actually left women with birth trauma and potentially actually midwives with trauma. And so I was coming at my work from the completely opposite end of the spectrum from compassion. I was looking at people's traumatic experiences. And what you might have picked up is that Diane and I have a lot in common. I'm actually a grandmother as well now, and a human being. So we have a lot in common, but we both worked in independent practice. We both worked in the NHS. We both grow vegetables. So we have a lot in common, but we also discovered, we met at a conference by chance when we were both doing our PhDs. Then we had a conversation, then we swapped our PhDs at the end and read each other's and realized that our findings were absolutely synchronized, even though we'd come from two different perspectives. And I think we've spoken about this before. And in my work, in my PhD, I do actually pose the question, where is love within this? Because what my findings were, we were looking at the needs of the individual human person. And when the individual needs of a human person are not met, ultimately we have trauma. And acknowledging the humanity, both in the families that we care for and in each other as professionals and in the multidisciplinary teams that we work with, that humanity and what's at the core of our humanity. And to me, the core in our relationships and our engagements, the core understanding of how we do that in a good way is when love is present in some form. So it's trying to unpick that. What do we mean by that? And that's what we're at the early stages of trying to do. And I think one of the ways that I think when Diane came to me a few months ago and said, "Oh, I've been thinking about this. What do you think about this? What do you think? I have an idea." And I said, "Yeah." I said, "I think we need to talk about love in midwifery." And I was like, "Yes, it's been said." So again, we were synchronized. So we're coming at it and we're trying to explore it. So that's what's led us to this point tonight to have this conversation. So Diane, we've both had conversations with people over the last months and we've had different responses. Maybe Diane is going to tell us a little bit about her responses.
Yeah, very, very mixed. So I've talked to midwifery academics, I've talked to practicing midwives, I've talked to student midwives a little bit about this too, and very mixed. So from one end of the scale, people saying, no, that's totally inappropriate, that would be unprofessional, and having that reaction. And every reaction is valid, I think, because it tells us a little bit about ourselves and also perhaps how we think of love. Like I said, it's a broad concept. There's a lot of different ways of looking at love. So we have had that reaction. People saying, well, it's not possible because it would take too much. It would take too much from the midwife. And I think what they're referring to there when I talk to them is that idea that that's going to take something of us, something away from us, something that we can't keep giving. And all those ideas about compassion fatigue and burnout and the burden of emotional work, they're all valid responses. But so that's good when people bring that up, because I think we need to talk about that. So right from those sort of reactions through to perhaps very positive, almost instant recognition, people's faces just lighting up as if to say, thank goodness somebody at last is talking about this, because I've always had this in my mind. It's why I came into midwifery, and yet we don't seem to talk about it. Lots of midwives have instantly recognised it. And I was talking to some student midwives and introducing that to them, that we were starting to think about this and we're going to be doing quite a big piece of work on it. What did they think? And students started just giving me their experiences, their little stories from their placements, etc. And one particular midwife who was just so excited about student midwife, who was in the lecture room at the time, and she was just so excited about it and she just said straight away, absolutely, it's all about love. And she told me a little story about looking after a woman who I think had come in. She was post-terms and she was due for an induction of labour, and she came in and she was actually contracting, and this student midwife looked after her, and obviously under the guidance of a supervisor, but she's quite far on in her training, and she looked after the woman. They had a bond. She provided really individualized one-to-one care, and then the woman progressed and had her baby, and it was all lovely. And afterwards the woman said to her, I didn't need an oxytocin drip because I got my oxytocin from you. And she was just so excited about it and saying that absolutely encapsulated what she tries to do when she is with women in labour. So yeah, lots of different responses that I've experienced.
And I've had similar range of responses, but I think the way I'd like to understand it is that sometimes there's a bit of unease. Oh, should we really talk about love, or is this not a bit unprofessional? What do you mean by that? What we have to be really careful and put boundaries in place, and I think that's, there's lots of reality in there and there's lots of truth in that. And what it was leaving me feeling was that we don't really understand, because we've not talked about it, because it's very limited. The writing about this is incredibly limited. There is some writing, but it's very limited. We haven't really explored it. And is it because we're a bit uneasy about looking at it? Is it a bit embarrassing? Are we anxious that people might think we're being inappropriate or misunderstand what we say when we want to talk about love? When Diane talks about the love between the mother and the baby and the partner, we all recognise that as humans in our, hopefully in our own relationship, but in just witnessing the families we're with, we can see all that, and that is very appropriate. But when we start talking about, do we have a role, and does love come into the role that we play as midwives when we're caring for people or when we're supporting one another, it's uncomfortable. And I think one of the ways that I've begun to look at this as we've had this conversation, because one of the responses was, well, are we not just talking about compassion? Is it not the same thing? And I think Diane's addressed that a little bit earlier in our thinking. But for me, it's like there is some way of being, some engagement, some aspect within our interactions with the people we care for and each other that has a core truth to it. And when that is good and optimal, then we have compassionate care and really positive experiences, and like that woman feeling that oxytocin from her student midwife. And when it's not there, we experience trauma. So there is something that needs to be present that differentiates between whether it's a traumatic experience or very positive, and lots of range in between. And I think it's for me, it's a wee bit like if we want to create a sculpture, if a sculptor is going to create a statue of a horse, say, what the sculptors will say is they can see the horse, but they've got to somehow chip away to find it in the core of the marble or whatever material they're using. And I think it's like this, we sort of know it's there, but how do we chip away? How do we chip away and explore what that is? And that's what I'm picking up from the conversations, is we don't quite know how to get at it and how to have that conversation yet.
Well, it is the right time because something's got to happen. The midwifery profession, and I mean, Sue's talked a little bit about problems in the NHS, in maternity care. We're not in a good place. We're told constantly we're not in a good place. Lots of reports tell us we're not in a good place. How can we possibly feel that we're in a good place? We've tried lots of different things. I honestly do not see that a lot of these very gloomy and very critical things actually have helped at all. I just don't see that. And I think we need to do something different. One of the things we need to do something different about is the big problem of fear in maternity services. That is really eroding a lot of what is good. And we know that will block. It will block compassion. It will block empathy. It will block love, I would say, too. So we have to do something different. And I think there's never been a more right time to think about what is at the basis, what is at the heart of the care that we give, and at the heart of what we're trying to do when we go to work and when we practice midwifery. So I think the time has never been more right to explore this.
And I would like to echo that. And in terms of, as Sue mentioned, the challenges within the education, midwifery education, as well as midwifery practice, I think everybody here will be aware that there are many areas where the culture in which we practice is very damaging, dare I say toxic. It's harming people, it's distressing people, the levels of trauma and PTSD are really high. And I think one of the things that saddens me as a lecturer is I watch the new midwives come in with great passion. Maybe some of you are here tonight, some of my new students, but great passion, want to get out there. And for some, they go into practice, and I've had them sitting in tears because of what's happened in practice. And it's not because there's been a very, significant adverse outcome for a mother or baby, although obviously there is distress if that happens. But these tears are not due to that. They're due to the way they've been treated, spoken down to, or bullied, or not even welcomed. That simple act of welcoming somebody onto the ward, into the team, as part of the shift for that day. And what is that? Where is love within that, if we're going to talk about, so we need to explore this. We need to look at, why is that not happening? And it might not be happening because members of staff are stressed and burned out. And when our human needs, as I said right back at my initial research, if our human needs are not met fundamentally, like really met, then that gives rise to harmful behaviour. Like, it's a known phenomena. So if we're struggling, if we've not had our rest, if we're tired, stressed, frightened, anxious, then the chances are our way of being present to others is not going to be as it should be. So I think we really need to talk about this. There was a paper that came out 11 years ago now called Midwives Eating Their Young. I don't know if anybody's read it. I think it's by Deb Hughes in 2012. And it struck me that I thought, what are we doing? Why are we doing this to our students? Why are we doing this to our new midwives? What do we do? Where is the love in terms of, we all came in with passion for this job at the beginning. Well, 99.9% of us, I expect. Where has it gone, and where is the love? So I think we really need to explore, as Diane says, talking about all the negative things, all the reports that have come out, all the really frightening things, putting on tighter schedules, tighter restrictions, more vigilance and monitoring of everybody. Is this making things better? I don't think so. But have we really talked about that psychological well-being and care of each of us as individuals, and how we then bring that into the work that we do? Because I think if it's there, not only are the experiences going to feel more compassionate, the outcomes are going to be more positive psychologically and physically. So I think it's absolutely important we have to discuss this now.